Well, Harjit, it's been an absolute pleasure. It has been.
Lance, it's been a pleasure being here. I love this In Conversation series that you're doing.
Fantastic.
Oh my God.
Hey guys, welcome to another In Conversation for this year. In the spirit of becoming a better version of ourselves and continuous learning, it's my absolute pleasure to have with me Harjit Gill, who's the CEO of APACMed. APACMed, for those of you that are not sure, is the industry body for across Asia Pacific on all med tech, including IVD as well. And so our topic today, and the reason why we've got Harjit here with us, is to talk about and explore the concepts around healthcare and inequity, and focusing on the areas of women's health.
It's great to be here, Lance, especially on a topic that's so close to my heart,
Yeah.
and that's women's health. No matter how far we've come in many different areas, I still think inequity when it comes to women's health, we've still got a long way to go.
There's a lot of work to do, and I think as part of the discussion today, I mean, one of the things I'd like to explore is people talk about access, but there's a nuance to access which is around inequity, and I think that's a conversation we need to have more and more.
Healthcare inequity for women, for me, really is about outcomes. Outcomes that are far behind the ones that you see for their male counterparts. I think there's still a long way to go when we talk about improving healthcare access for women and getting more parity when it comes to outcomes. A lot of the reasons, though, behind this, especially in this region, have to do with financial security and autonomy for women. I mean, we are half the world's population, but still biggest part of the poor population are women. Secondly, there are many societal and cultural barriers in this region. And that just puts a lot of restrictions, especially for women, in terms of having a certain degree of autonomy in managing their own health. Women's access to education still needs to go a long way in terms of improving their understanding, but also taking ownership for their health. Societal pressures, I think, in this region are also putting a lot of pressure on women because they don't seem, in all cases, to have that autonomy. Yeah. And I think there's a statistic that I read, in fact, from the work that Roche did, that 1 in 5 women actually delay getting treatment for specific healthcare issues because they're busy with the family.
For me, one of the questions I get asked is, this seems to be lumped in as a general access question, and in all honesty, it's not. So even if you said we have, 47% of the world's population does not get access to basic diagnostics. Okay, if you solve that problem, we still have inequities given that the system doesn't deliver what specific groups need, men versus women, as you've described. For me, I think almost the role of a woman in the household according to society, women will put their family's well-being ahead of their own and maybe not interact with healthcare systems as much. So I think, there's so many elements that play into this question around inequity, and we've got to move beyond the access conversation as a bucket and get into specifics of what needs to be done to address these challenges.
I really think that one of the ways to get around that is to educate more. And whatever solutions that we put out there as an industry, they should go hand in hand with education. Yeah. And I think one of the ways, actually through my experience, is really about building communities. Because women tend to rely so much on each other. And it's only through putting communities, grassroots communities, that you can actually get certain messages across. The last thing I would say actually is also industry has quite a big role in terms of shaping, how this can be improved.
That you pick up on the industry piece, and this is something we talk about a lot internally, and as a market leader as we are in IVD, we've delivered a lot of tools into the healthcare system, and one of the things that we need to understand is even if those tools are available in an environment, they're not necessarily being utilized for the reasons that you described. And then so what's our role as an organization to help go the next step? And what we need to start doing is, I described it as a little bit like a football game, for example. Instead of being on the sidelines and providing balls and boots and socks, we need to get into the game and start addressing the ancillary reasons why a test, a critical test particularly, is not being taken up. For example, we know the societal dynamics and, in a sense, a judgment actually influences many, many people, and we've seen this in terms of the uptake of HPV testing for cervical cancer in women in places like Malaysia.
What do you think industries could do differently when they then take their solutions to market? And I've seen some great examples in the region, especially around maternal deaths. So if you see today, we're still losing 300,000 women during pregnancy and childbirth.
Right.
And 99% of those women are in this region. And 75% of that can be improved through education alone.
Yes.
So having an education element as part of the solutions that you offer, I feel is one way.
Yes. I could probably speak for all of us in the industry where we would say, yeah, but we have education. But I think what is the piece that's missing that we need to crack is, we need to get alongside everyone in that healthcare journey, shoulder to shoulder, and say, this is what we're trying to solve for.
Right.
Regardless of whether you're a healthcare provider or whether you're from the industry or government, it's going to take all of us to deliver our piece to solve that problem. And I think this is the step that hasn't gone far enough. It's more about how do you deploy your educational content.
Precisely.
And when you address that, you then start thinking about, well, what is it? We're a science-based company. So we're very comfortable having conversations around sensitivity and specificity. But does that land with a woman in Malaysia when we're talking about HPV testing? No, of course not.
No.
So, it's really taking another step into the healthcare game that I think we all need to do.
But I think that's what's so interesting about our industry right now. Because if you're working in this industry, it is about working and pulling together that ecosystem to get those solutions out. Just taking the solutions alone or having the solutions alone is not going to cut it. So I think as companies get more and more understanding around specific disease areas,
Yes.
and especially the cultural taboos around them, will require a different approach.
And finding a way to address those.
Exactly.
Yeah.
Because we won't be able to reach the levels we want to in terms of healthcare outcomes if we don't do that.
So I think we need to acknowledge that this is a big, complex topic, right? So what I'd like to see is some, and to use today's terminology, some successful use cases where we're actually addressing the various elements of inequity for perhaps a disease state. So if we were to take something like cervical cancer, for example, okay, I would love to see a successful blueprint put together in an environment that has the challenges of society and finance and a lack of education, and the villages come together and we've actually created a model that we know works,
Right.
that we can then go, okay, let's now scale
it.
this. And I think that will help us break the mold of healthcare delivery today. And I would just love us to see that, because then we're dealing with the systematic problems, not the individual symptoms.
Yeah.
And that I'd love to see us be able to achieve that.
And I think you're totally right, Lance. This is a systemic issue that needs to be tackled from all fronts. And if I look at the work that we do at APACMed, it is really around building advocacy on key issues like this.
Yeah.
So I think as more and more solutions are developed, having those use cases that we can use to share with policymakers,
Yes.
and to get the relevant reimbursement or regulatory approvals in country is critical.
Yeah.
So that's a way that we can actually collaborate,
Yes.
and that's the way APACMed leverages then the work that our
Across the
member
members,
companies do.
Yeah, totally agree. And if you look at it from the policymakers' perspective as well, I mean, everybody knows there's these problems and challenges, but it takes a brave individual or group to bring in a new model. So if we're able to show use cases that with proof points that show actually this step is the right thing to do, minimize the risk, address whatever elements need to be addressed, then the willingness for policymakers to take those things up should be a lot more.
Yeah, and there's a big gap in terms of capacity and capability in this region when we talk about policymakers and regulators. So those people in that position to make the change.
Yeah.
And I think we have a great opportunity also to build those capabilities by sharing some of these new solutions.
Yeah. Well, Harjit, thank you so much. It's been an absolute pleasure having you here in our discussion today. In Conversation is a program that we have within Roche Diagnostics Asia Pacific whereby we discuss key topics in healthcare and try and bring out some of the more core elements associated with those topics so as we can educate the environment, the people in healthcare and the people around to improve the lives of people across Asia Pacific. So once again, thank you so much. Thanks for your insights. Wish you all the best.
It was a pleasure. Thank you for having me.
Thank you.